Kids, when they get TB, are more likely to get extrapulmonary TB, which means TB outside the lung. And the way they get TB is their lymph nodes, especially the lymph nodes in their neck and in their underarms. Those will swell up. The mothers will feel a lump while they're giving a bath to the child. Okay, or they will have fever more than 2 weeks, or they will have cough more than 2 weeks. There will be weight loss. There will be night sweats. So that's the classic presentation of multi-system TB. But children, mothers should be aware if they see or they notice large lymph nodes which stay large for more than 3 months, they should definitely come and get checked. And at the same time, if the child is running fever and is having unexplained cough for more than 2 weeks, these children need to be assessed for TB.
How do you get TB?
So you get TB by inhaling the bacteria from the air. It's known as what's called a droplet infection, and children will be infected by infected adults around them.
So if your child goes to school, could they be at risk?
They could be at risk if they are sitting in underventilated rooms and there is somebody in that room who is coughing and who is coughing out TB bacteria into the air.
Is it very widespread in Pakistan?
Very widespread. So this is a high prevalence country. In fact, among the top 6 high TB burden countries in the world. So in TB, actually, it's known as endemic. So the TB is very much present in Pakistan, and it's a differential of most of the bad illnesses which make a person get admitted.
So it feels like it's a really like olden days sort of. It's a poor person's disease. Is that correct?
So, in a high burden country, unfortunately, yes, poverty is a risk factor. Underventilated rooms and overcrowding within a room, so household density is one of those risk factors. Smoking is a risk factor, definitely. So, poverty is a risk factor in the spread of TB. But in an endemic country like Pakistan, the rich, the middle people between the rich and the poor, everybody is vulnerable to TB.
And how do you treat TB?
So that's what's improved from historic times. We have an excellent regimen which is given for free by the Pakistan TB program, which is the National TB Control Program. They have centers all across Pakistan where TB medicines and TB diagnostics in the form of sputum tests with rapid PCRs are done. And once the diagnosis is done, the government takes care of the TB treatment and the multi drug resistant TB treatment also.